Hey guys, so my name's Kelsey. I'm a nurse at Norton in Louisville, Kentucky. So the opioid crisis is actually pretty close to home for me. So I chose an article from the Courier Journal that discusses the mayor filing a lawsuit against three major drug companies regarding their responsibility in the overdose crisis that has happened this past year. It says that the mayor filed a lawsuit against three of the major drug companies, but then later in the article it goes on to explain that he is actually not the only one that has filed a lawsuit against these drug companies for not taking responsibility for the opioid crisis. But there are other people that have also filed lawsuits that are pending against the drug companies. It just says that um, the companies failed to monitor and identify suspicious activity and reported to the U.S. Drug Enforcement Administration. Um, so it also explains that the crisis had a huge impact on not just the community as a general, but like on police and firefighters and the hospitals because like I know my hospital, we got super packed whenever all this was happening. And every day we had an overdose in the hospital that we were having to take care of, or whether it was just they were in the ICU for an overdose that they were having to come like be resuscitated from, or it was the step down to the med surg unit, and then not only were they experiencing the respiratory failure, but then we had people coming in with infected arms and with cellulitis from where they were using dirty needles to inject themselves and they were having surgeries. So I would say probably we at least have one of these, if not more, on our floor every single day of the week. So it's a pretty big issue. It's costing our hospital a lot of money to treat these people and to take care of them because they're constantly coming in. So, yeah. But so instead of using the pain medication for the pain relief, I actually chose to do massage therapy. Um, I actually love massage therapy because I use it for myself because I get really bad headaches, and they always wanted me taking like muscle relaxers and Tylenol, but I went to massage therapy and I actually got rid of most of my headaches. And I actually use it a lot in my patients that I have on our floor if they start hurting or they're like cramping up or anything. I encourage them to actually use massage therapy because I think it is a great way to relieve their pain. And it's proven to reduce pain and relieve certain like joints and tendons. Okay, so I'm teaching. So, like I said, I use therapeutic massage to relieve pain. My audience, the audience will be focused toward the patients with chronic pain, the people that typically have to take the pain medication often. And instead of doing that, we can just use this alternative therapy and then use the pain medication as a secondary form of pain relief. Therapeutic massage has actually been directly related to relaxing parts of the body, such as muscles, joints, and tendons, to reduce the pain a person is experiencing. Teaching the patients about the therapeutic massage and its benefits to relieve pain would reduce the amount of opioid pain medication used to treat the chronic pain. Not only will the massage therapy reduce the pain a person is experiencing, but it is also shown to enhance other aspects of their life, such as their sleep and anxiety. The education provided will be very simple for beginners, and it'll just be simply educate the patient on the various benefits of the massage therapy to relieve pain because you should have it performed by an expert to get the maximum results from it. I would expect the patient to have no previous knowledge of the topic. The goal of my teaching is at the end of the presentation the patient will be able to understand the benefits related to the use of therapeutic massage. My teaching handout is very different, has the different benefits of massage, not only with pain relief, but also there are different types of pain that the massage helps relieve, such as neck pain and headaches. So it goes into the different types of pain that it can, like getting your neck massage can relieve your head pain, or like getting your back massage will relieve just your back pain. I'll actually sit down with the patients one-on-one and explain the handout thoroughly and answer any questions that the patient may ask. So for my learning objectives for each of the domains, I'll just read them for you. The patients will actually be able to identify 2 areas that the massage therapy can relieve by the end of the education process. Patients will be able to identify 2 other ways massage therapy can benefit their body other than pain relief by the end of the education process. The patient will verbally agree to try different therapy other than the medication for pain relief. This, I think, is very important, because without the agreement from the patient to even try another type of pain relief, they're not going to do it, because most people, when you go in there, the number one thing they want to take a pill to get rid of everything. So if you can have them actually have an open mind about the therapy, then it would allow the education to go further for them. Also, throughout the therapy, I'm going to ensure that the patient's making direct eye contact and present with active body language throughout the education, because if they just seem distant, if they're in a lot of pain whenever I'm trying to explain this type of technique, then they're also not going to listen. So I want them to have, like I said again, an open mind and free of other distractions or anything, just to make sure that they understand what's going on and that they're going to cognitively accept what I'm presenting them. And then I'll also ask the patient to perform any certain massages that they might do for themselves to help relieve pain, just to kind of show me, like, if they have a previous understanding of it. I know some people, like, if they have headaches, they'll massage their temples or they'll massage the backs of their necks. So if they have anything that they like to do before, I might ask them to show me to see if they have any previous knowledge of the situation or the therapeutic massage. So for me to evaluate before the education begins, I will ensure the patient is cognitively capable of understanding the teaching. After the education is presented to the patient and throughout the entire process, if there are any questions the patient may have over the massage therapy, I would encourage them to ask all questions at that time. Once all the questions are answered, I would simply just in return ask them questions regarding the education to make sure that they had a full understanding of the handout and what the information I'm presenting them. If they'd like to demonstrate anything that they might have learned, they're more than welcome to do that. So here is my handout. Right, you guys can see it. Oh, it's not going to show up. Let's see if that works. So right there you can see, right here you can see where I have the therapeutic massage in the large all capital letters, so they know exactly what the teaching is going to be. I have 4 clearly stated topics for coverage for them to go over. How does massage treat pain? According to the Harvard Health Publishing, therapeutic massage can relieve pain in many different ways. Massage relaxes painful muscles, tendons, and joints, and overall provides pain relief in the body. It is also said that massage can close pain pathways, leading to long-term pain relief, which, like I said, would help with the chronic pain relief. I have the pictures just to kind of draw people's attention to the different topics. What else can massage do for you? Not only does therapeutic massage relieve pain, but it can also benefit the body in its other ways. Therapeutic massages can Also relieves stress and anxiety a person is experiencing and enhances sleep patterns for increased rest. Um, are there any negatives of massage therapy? Currently, there is no research that suggests that massage therapy is negative in any aspect. It is not frowned upon, but there are some instances that massage therapy is not used for injuries. If a person has an inflamed area on the skin, massage could potentially irritate the area, leading to increased pain. So they need to understand that there is a time and a place for the massage therapy. And then what types of pain does massage treat? Headaches, low back pain, neck pain, sports injuries, and chronic pain. So I made sure I kept it simple so they only had 4 messages and it wasn't too much information to go over for them. But that is my teaching, so hope you guys enjoyed it.